Alicia Webster, and I am a forensic nurse. I have been a forensic nurse since 2016, and I have practiced in Albuquerque, New Mexico, and here in the District of Columbia. A medical forensic exam is a specialized exam conducted by a nurse who has underwent specialized training in forensics. If you are a survivor of intimate partner violence and have been assaulted, you are eligible to receive an exam with the DC Forensic Nurse Examiners. During an intimate partner violence exam, we will evaluate your overall medical history in addition to incidents that are pertinent to whatever you've experienced. For example, when you come into our clinic, we will take your regular vital signs, check you from head to toe as you would going to see your primary provider. After that, we would ask you exactly what happened. This is what's called your narrative. What that does is that helps guide the forensic portion of the exam, which is a little bit more specialized. What that portion includes is injury identification and documentation. We document both in writing, but also through the use of photos. For example, if you have an injury, this was an injury on someone, we take 3 different sets of photos. The first photo is from a little further away to show where the injury is in location on the body. The second photo is used with a measuring device to see exactly how big it is and where it lays anatomically. And the third photo is a little bit more up close so we can see and identify exactly what injury that would be. There are screenings that we do for strangulation. Strangulation is something that is very fatal and is a leading cause of homicide among women. These are a few of the items that we can use to help with our injury identification. One of the things that we will ask if people feel comfortable to do is to demonstrate on a mannequin exactly how that person was strangled. This can be difficult for a person to do, but what it helps do is we as forensic nurses can see exactly where the pressure was on the neck, and that helps to guide for injury. For example, if this was a person and I was doing an evaluation, I would also use additional tools to be able to check their eyes, inside of their ears, and other areas of the head and neck that most people who do not have specialized training in strangulation would not be able to see signs or symptoms of. You can also use what is called an alternate light source. This can be used alongside strangulation or all on its own to identify injuries on the body. One of the benefits to using an alternate light source such as this is it makes it easier to identify injuries that sometimes may not be visible to the naked eye. What that means is that this tool can pick up bruising, injury, and things that are underneath the skin that sometimes do not show up in regular light. So for example, we use these specialized goggles and lights to look for injuries that we can then makes them a little bit easier to see. These exams are free, available to anyone with or without insurance, and are available with or without law enforcement involvement. To contact us for these exams, you would call the DC Victim Hotline, and that phone number is 1-844-4HELP-DC.